Good morning. It's Tuesday on Your View. Welcome to the show. I am Moriah Afolabi Brown. As always, I have the ladies with me. YK in the building.
At last.
You've been gone for 2 whole weeks.
At last. Well, you know, what happened was I fell ill.
Yeah.
And I said, look, if I be cool, let me sit in my house.
But you didn't get tested.
That's my choice.
I didn't get tested.
Yes,
Well, within a few days I was okay, but I just stayed home
just in
for
case.
2 weeks. I didn't even go to Shrine. Shrine was still open then.
Thank you for respecting humanity.
Thank you. Thank you.
But you're feeling good though. You have the kids at home.
I caught cold from the children. Can you imagine?
It comes to the territory.
Because the weather is changing as well.
Yeah.
I don't think I've had a cold this year.
At all.
This is the first time
Yeah.
I'm like, and the other noses are running.
Yeah.
Femi's baby and my own 2 small grandchildren. It's not easy.
It's not easy. No, it's not easy.
It's not easy.
Okay, I handle 4. But I have one also that's not
I'm just
feeling too
frowning
well.
24/7. I'm frowning. I can't watch TV. I can't even watch Your View.
Because
I'm on Cartoon Network.
You see, now you see, so you
Because
have
you
to
took care of only one child. So it wasn't, it's not like you had plenty. At the
Yes.
same time.
Yeah, exactly.
I
But the thing is that you see, mothers who try to still fly, who look good, you should give them credit. That even with
us
all
credit,
the
you know?
wahala, they are still managing themselves. I mean, we
One
should
is
give
like
them that.
500, my boy is like 500.
You one is equals to 4.
Wait now. That's we are seeing you when you are flying. When I come to your house, I know it's not a different thing. I will say, hey, your hair will be like
Yes,
this.
yes.
Your
Hiding
your head will be turning.
What's interesting happening?
Yeah, so we are phasing into the new year by the grace of God, and this is the time most people start looking at their plans, the goals they want to set for the new year. I didn't start on time because of everything that was happening. Normally by now I would have set my goal for the next year, but I've not even wrapped my head around what I want to do for next year. So I want to take my time. I'm still thinking about what I want to do in my head. Take my time. Then probably from January I'll start putting it down one at a time. There's no hurry. There's an adage in my place that says, so when you wake up is your daybreak.
Hey.
So nobody should put me under pressure. You must achieve it, and I'm taking my time.
I think that's
gradually.
one challenge thing. That you started.
Yes, it's going to be a January gratitude challenge.
So what do you want us to do exactly?
Okay, so write out 31 items that you want to thank God for.
Okay.
Whether it's your family today, tomorrow your marriage, next tomorrow your children, 31, and every day we pick one and we are grateful to God for it.
Great. Okay, we'll try to join you. Meanwhile, Akasha Ziviri.
Yeah, one per day.
Okay.
Nice. How you doing?
Okay, so this particular tweet, Twitter fan sent a shout out to our auntie, Mrs. Abimbola Oyedele. BC Laiwola is wishing you a happy birthday, Mrs. Abimbola Oyedele. And I must beg TVC Connect to leave this on our YouTube page because all the shout outs that we've been giving to our UK fans have been missed. I've been getting feedback, yes, that they've been edited out. So I said I was going to say, but just so you know, even the one from Mrs. Ogini yesterday, she didn't get it. And it's painful. Because,
But she watched it online. She watched it live.
She was,
but she just couldn't watch.
she's in the UK, so she's watching on YouTube live.
Ah.
So, you know, and it was no audio initially. Nigerians were calling and saying, we heard your name on TV. And she's trying to get the
Have you seen the one Miriam posted?
It's from, this is the one Miriam posted, and I also got that tweet.
Okay,
as
me, I also have a birthday shout out from one of my big sisters, Mrs. Dotsun Ajiboye. Today's her birthday. Happy birthday. She's one of those sisters that you know, not blood, but she was like thicker than blood. Like, you know, she's that kind of really close sister. And she helped me. I mean, there was something I remember. She doesn't even know this, but after she got married, she was just giving me a gist about her marriage. And she just said, Morel, And that statement she told me is what helped me in marriage. She never knew this, but she said, that's the other room business. She said it in a nice way, in a very, I can't say it on TV. She said, Morel, that thing is good in marriage.
Are you kidding
As
me?
in no holds barred. You can just, you can be
Free.
free or you can do anything.
All due
you know?
page.
And telling that to a single,
It's a breakfast.
but
All
telling,
due
but the point
page.
I'm trying to make is that telling that to a single young lady made the difference, made a world of difference to me because it made me keep myself. Like, you know what, that experience, I'll
want to
wait
have for it.
and I'll wait it. And she didn't know how that statement impacted my life, but it did. And I thank her for it. And she actually framed and helped me to ensure that I kept myself. Happy birthday, Stardust, and God bless you many more years. Okay, let's go.
Please, I just want to say I'm happy with the child.
Yes.
Wow.
It's all living and complaining.
All ladies are not.
Ah,
They are
sorry for you.
We're squeezing our legs.
Well, see, hey, God, I can put my leg down.
For those of you that don't
I can do like
understand
this.
what YK
Hey.
is, but those of you that don't understand YK is, before the set, YK animals like used to hang.
Like
bats.
Like that. So they used to complain that the show was too high. Now the tall ladies are complaining that this is too short. And YK is perfect
That's
for you.
how life is not
That's how life is. Let's
Life
go
no
and
balance.
When God smells some people's own, he blesses some other people.
Yes, sir.
I'm in that group.
Okay, we have to run. It's Tuesday. There's a lot of serious business to deal with. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.
And staying with us, we're going to start with the nation. Kuga's attack on Buhari draws more flack and backings. 2021 appropriation bill sent for assent. How my husband and I ship young girls to Italy for prostitution. Lagos battle at Papa gridlock with special squad. 23 die in Lagos inbound accident. Covid-19, Lagos opens 10 oxygen centers. And Man United to dump Igalo for Cavani. Okay, should we start with the Lagos
The
Papa?
human interest.
The human, yes. Let's
That
start with,
woman, yeah.
you have that story, right?
Yeah, no,
This is good.
23 dead.
Okay.
Yes. So a truck that was bound for, I think, from Niger State, according to the police commander, said that the truck had a lot of cows and 45 persons, and then it skidded off the road and 23 persons died instantly, 22 were injured and rushed to the hospital. So the command, that's the commissioner, was saying that the loss was as a result of the fact that the driver wasn't careful and they do not obey traffic rules. So they are going to be talking, see how they can talk to a number of drivers and train them on how they can pay attention and obey the traffic rules. Let's not also forget that our roads are really not good, so everything should be done all together.
Right.
Yeah.
Okay, we'll take it in being I have the human interest story. A lady, Mrs. Comfort Innocent, confessed to the Ogun State Police that herself and her husband have been trafficking girls for 22 for quite a bit actually, and she was arrested back in December 22nd. Her husband lives in Italy. So what she does, she traffics girls, and her husband receives them in Italy, and they push them into prostitution. They've been doing that for many, many years. And the reports followed the arrest by Oluwaseun Aduratola and Sikirat Patase, who are residents in the town, and they were the one that actually reported to the police. Really, really, really pathetic story. Let's move on to.
I said they should be prosecuted.
Oh,
Yeah.
That's a crime.
Okay, let's talk about, let's move on to Vanguard because of little time. Fake COVID-19 test results on sale at Lagos State government raises alarm. At Papa gridlock, Lagos takes over traffic management from PTT, says Sawolu. Northern groups can SMBLF clash over Kuka. Lagos-bound truck crashes in Niger, kills 23 and injures 22. IBB, Abubakar, others pay tribute to Sam Nda is buried. Let's start with the major headline story, the fake COVID-19 test results. I had that story.
Okay.
So, obviously, Lagos State has raised the alarm that there are people selling fake test results to Nigerians, and that they're obviously doing everything to clamp down on them. And they noticed about 8% of those who come into the country actually bring in COVID. Many of them refuse to go for testing. And they have about about 200, so far in our country, in Lagos, I think we have 236,012 and tested positive so far.
Out of this kind of
Over 236,000 tested so far.
Oh,
They
yeah,
also.
because,
Okay, go ahead.
yeah, what they're saying is that they don't leave the right address, so you cannot even contact trace them later on. They just give fake addresses, bring fake results, then they don't go for that 7-day test again. So if they are coming in with the disease, they will just be spreading it. Now, I know there's this one in England right now. The
second wave.
when my daughter was coming back on the plane, they removed, I think, 2 people who had brought.
COVID-19.
No, they had brought in fake results. I don't know how the airlines discovered. But I mean, come on.
It's really
In a related story, the federal government is thinking of banning flights from the UK and US into the country because obviously, as I said earlier, 8% of them don't actually, many of them actually are positive according to the Commissioner for Health.
But in addition to that, quickly, some consultants are saying that banning the flights from the UK and US will not pay us economically because they are still trying as much as possible to adhere to the strict guidelines done by the airport. So
let's talk about Papa Gridlock for a moment because we have very little time.
So the Lagos State government has said that they want to take over managing traffic in Apapa from the federal government and the presidential task force on Apapa Gridlock. That, you know, Governor Sanwo-Olu saying that this is about 4 times now that they've addressed the issue of Apapa Gridlock and that they don't have any results. And I'm wondering if they want to resort to another human management of traffic, they were still going to end up where we started. Right now, they've decongested the Kirikiri axis of Apapa. They've decongested Mile 2 this morning inward. Mile 2 into the Badagry Expressway was free. But those coming from Badagry Expressway towards Mile 2 were stopped because all the trucks are packed all the way from Mile 2 down to Trade Fair. You can imagine from my entrance of my community into the express, I'm driving beside trucks packed by the road all the way to Mile 2. So we're stuck in traffic there, and there was nothing that could do.
So the government has said
they are robbing pizza to people.
So if you want to decongest Apapa and environs, and make sure that there's logistics, I met a guy, Kaya Logistics is his business name, and what he was talking about was, his name is Olabilonge, was how to use technology to decongest Apapa. So if a truck does not have to be at the port, that truck will not have left the park. You know, they give them the way they do in London, and we will see proper traffic management, unlike what
so right now,
authority members are saying that we should leave.
You're right, and I think that the governor saying that he's going to be deploying 400 to 500 last mile officials is one thing, but it's another thing to ensure that he's also speaking to all the freight forwarders, the ship owners, all the terminal operators. These are, so he's engaging all the various stakeholders. Now, let us see if
I
indeed
pray that they present the
actually
cases the way it's supposed to be, with solutions in
They
mind.
said a drone shot of this axis and more of your Papa Jeremy will do them, a lot of justice.
Okay, well, our final people, unfortunately, we are running out of so much time. I was going to take Daily Sun. Cookers trending. Cookers trending. So let me take that story in the Daily Sun. Furore over Cookers Christmas bombshell. Covid-19, and we talked about that already. Let's find another story. Apapa Gridlock, we mentioned that. Fidelity Bank appoints 3 non-executive directors. So who has the Reverend Cooker's story? Who has that story?
So we have the story. I want to quickly quote, because I took a bit of it yesterday, what he said in his Christmas message. That's Bishop Cook. I said, the government owes the nation an explanation as to where it's headed as we seem to journey into darkness. The spilling of the blood must be related to a more sinister plot that is beyond our comprehension. Are we going to remain tied by these evil men, or are they gradually becoming part of a larger plot to seal our fate as a country? This was him just, talking about what we know that has been happening, the killings, the banditry, the kidnapping. These are issues that everybody sees, so it's not hidden. But then the CAN is in support of the statement, but the CNG, I want to get the exact title for CNG. I saw it just now. Coalition of Northern Groups are against him concerning the statement, saying he's sort of fueling religious issues, and they are taking him to the ICP, International Courts. They are going to take him to the international to come and answer to him trying to instigate people to fight against the presidency.
But others are saying that he's stating the obvious.
One of the comments one of the comments he made was the nepotistic attitude of the president.
And as a sinister plan to establish a northern hegemony, which is so. And he's been saying that many people feel that way. Others agree with him. Others are against him. So it's both divided.
Can we even try?
They're even saying
I'd like to see
that he's inciting a coup. He didn't. He said if Jonathan had tried what this president,
there would have been a removal.
Of course. Can we try as much as possible not to crucify the messenger? Pay attention to the message. Is the message true? Can the presidency actually tell us what is happening? People are asking questions.
When we need the president to address some of the kidnap and some of the killings, and we don't get an address. But the moment there's a one side, they then address the person.
Yeah, but you see, I think the president is not getting it. That one-on-one with the people.
Connection.
Don't go and record message and then put it on. Talk to us.
Yes.
As a father.
Unfortunately, we have to wrap up at this point.
If
We
you don't
can't take.
applaud, nobody's going to
We
want
ran
to
out
hear
of
you.
time
I
on
want
this
to
paper
finish your
review.
focus statement.
We'll discuss the Rebecca cooker because it's obviously trending today. I mean, we'll discuss it. We read it thoroughly later, and then try to get various sides of the story, and then maybe make it a hot topic. Let's go on a break. We'll be right back. Thanks for staying with us. So, hashtag justice for Don, I think is, let me get his right name, the young boy
Yes.
who was allegedly molested. John Davis, yes, hashtag justice for Don Davis. Davis is actually trending. And this is the young boy who was allegedly harassed, malnourished, and from his school. And his mother cried out, I think, last week. We took the story. We didn't want to focus on the issue. We wanted to focus on the bigger issue of bullying in school and all that. But the story is still trending because the mother is still on air. She's gone out, came out with a video recently, just a couple of days ago, talking about her experience when she was summoned by the Permanent Secretary of Education and the Commissioner for Education for State. And she said her own side of the story. Now, our team is working very closely to see if we can get comments from the Commissioner for Education and other parties involved, because it's always important to have a balanced conversation. But in the meantime, as mothers and as we understand where she's coming from, we'd like to hear your thoughts on what has happened so far. And what we know so far is that, yes, the boy was allegedly molested by his colleagues in school. He used to bedwet, and because of that, he was taken to the seniors' hostel, where, according to her story, they were putting their hands and feet inside his anus. And she got him checked by the hospital, and the doctors confirmed, according to her story. And now she wants justice for this young boy. And what was even more disheartening, according to her story, is that when she was called by the Commissioner for Education, she told them specifically that her son is in a hospital, he can't come. But he insisted, and she still now she went against her own will to bring the boy to the office. When they got there, according to this woman, they didn't even start with the issue. The first accusation was, why did you put this matter on social media? You've brought disgrace to the government. And that was for her totally unempathetic and very insensitive.
Selfish people.
It's like, you're not worried about what happened. You're focusing first on your own reputation. After that, when they now did finish all that hula baloo, they now said, hey, boy, what did you say that happened to your anus? And she now felt that that was totally, completely insensitive also. So in your view, now, we are only having this conversation based on a mother's expression of what happened. As I said, our producers are working very closely to see if we can get comments from other angles. But we are mothers, we cannot just see a woman lament and just look away. This is still trending, and we'll continue to follow that story as we get other sides. So we're waiting for the school themselves to make an official statement, we're waiting for the government to make an official statement. In the meantime, what are your initial thoughts when I saw
this woman's post? I could feel, how pained she was about the things that happened. So I saw her video the second time when she had gone to the commissioner's office and she was making another video saying they asked her why did she post online, and they also asked her to delete the earlier post to take down all her posts about her child. And I felt, where I'm from, people say, na nakedness is a fight, picking fight, meaning that you go mad, you go to the worst, you show your all level of craziness when your child be a threat to the well-being of your child. It's been threatened to show your mother nature. So you fight to death, you fight to finish, and that woman did what she could. And then I saw a picture of the boy before school, and this boy, coward, beaten, pushed into himself in his shell, seeming into a corner because of what he's gone through. And this is a boarding school. A term is 12 weeks. A term is 12 weeks. So imagine that every single day, this boy was... I know people who at 12 were bedwetting. Yes. It is a natural thing. If you take them to psychologists, they will tell you how to get them to stop bedwetting. But when they are asleep, that's the nature of most people. And I know a lot of adults now who did the same thing as children. So, yes, they came to school and it was bedwetting. The school did not have a policy psychologically on how to help that boy. Why push him to a bigger house without supervision?
You see, the thing is, where I even want to come from is, if the story is true, that they called her and were asking those stupid questions, and I stand with, I say it with no sense of responsibility, it's stupid questions. Your child has been sexually abused, a boy, by other boys, and those are the questions you can ask her. They deserve to be sacked.
All of them.
They deserve to be sacked, if it is true. Because there is no reason, from the principal to the commissioner, all of them should lose their jobs. What are you talking about, disgrace?
Reputation.
Reputation. On my child's life?
Whose reputation?
On my child's life? You're talking about reputation? You're talking about disgrace? Please, 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 please. If I'm the commissioner, quickly call us now if you are watching this show and deny that you said all those things. No sense.
Right thing. So when I saw that video, I was angered in my spirit because I could feel the mother's pain. I could feel injustice. Because I remember one of the things she said was that one of the parents of the accused boys brought out a belt to flog her in that meeting, and everybody stood, nobody was stopping the man. So I just felt that it was something that people wanted to cover. They were ashamed that it got out, and instead of paying attention to the child who has been molested, that child needs psychotherapist, that child needs counseling, that child needs a lot. Nobody is saying anything about what they are planning to do for that child to take him out of that phase. It's going to take a while. That's a life that, God forbid, has already been destroyed. Nobody's paying attention to that.
You see, as I said, we are going to talk about this issue once we hear the other side of the story. But we are trying to analyze what happened. Summoning a child who has been allegedly molested to your office, for me, is even a no-no.
Thank you.
Why would you even ask? You see,
your APC cannot leave your office to go to the hospital and see the child. You are too big.
So a commissioner will not leave her office to go and visit the child in the hospital or go and see the family. You are summoning them to your office.
To suicide in children.
That is what I'm saying.
What would they tell themselves if that boy should commit suicide?
They don't care now when they are all done there abroad. You don't understand. If it is part of your investigation to get to the hospital and see the condition of the child and talk to the doctors.
Exactly.
But because you are politically appointed, you're not even qualified to be a commissioner for education. You have no empathy, nothing at all to make you a leader. You decide that, no, I'm too big to go. Call that mother. She should bring that boy for me. All of you bring them to town hall meeting. You are the royal ballet in their place. Call them. All of you come to town hall meeting in my office. Now you, why you post video? You, why did you do this? You, why did you do that? All of you make up and go home.
Appeal to child rights activists, child rights activists, wherever you think you are, to fight for justice for this child. Find out what exactly is happening. This is not the time for us to, everybody to, it's not my child, it's not my business. This is the time for us to start asking questions. Let there be proper investigation. We need to hear from the school.
We have to wrap on this.
Let me just say what a proper investigation would be. Now, this boy has alleged that he was, so and so handled in the hostel where he can identify the people in question. There's a test result showing that his anus, of course, has been broken. So you have a result, a documentary evidence you can rely on. You now take the boy, call out the number of boys who did what and what to him. All the boys in that hostel are suspects. Pack them, no matter who their father is, for investigation. You take them to, and then when you find who and who the boy has alleged touched him based on his own account, these boys will now be prosecuted.
What you do, if you are his word against their own, send them for lie detector test.
Yes, now. If they don't want, which they have in Alagbon, it's only for they have in Nigeria. They have in Nigeria, it's only for better people they use it.
Okay, we have to go, unfortunately. But we can't take this further. And the reason that I said it earlier is because we are waiting for other parts of the stories, because these are building blocks. So as it comes, I know that the school actually made a statement on Twitter. We're waiting for a proper official statement, and for the commissioner involved, let us wait for them. Once they speak,
which commissioner is it?
Commissioner of Education
in which states?
I think
Cross
it's
River.
Is it Cross River?
I think it's Cross River.
So
we'll
contact them. Our producers are working on that.
I'm just hearing the story for the first time today. So the thing is just annoying me.
Okay, well, let's go on a break. When we come back, we'll move on to another topic. But as I said earlier, this is something that we saw the video, we saw it earlier, we took it last week, and we thought it was important for us to follow up, and we'll continue to wait and follow the story to ensure that this boy gets justice. Stay with us, we'll be right back. Thanks for staying with us. According to the chairman of the Nigerian Medical Association, NMA, FCT chapter, Enema Amodu, at least 20 Nigerian doctors died from complications arising from the coronavirus in the last 1 week. He said the diseased health workers include consultants, professors, and some resident doctors. On the show today, we'll be discussing the battle against COVID-19 pandemic in Nigeria. You can join the conversation by sending us a tweet on Activity Connect. Please hashtag your TVC so we can read your tweets. We have with us Professor. Good morning, sir. Are you there?
Yes, I am.
Chairman.
Good morning.
Good morning, sir. It's good to have you on the show this morning, sir.
Thank you. Happy New Year to you.
Yes. So we have with us the President, Nigerian Medical Association, Professor Innocent Ujah, joining us to discuss this segment. Sir, so according to reports, 20 doctors have died, obviously, as a result of COVID-19. And we read in the papers yesterday that the Nigerian Medical Association will be doing everything it can to get the PTF and the Ministry of Health to support in training doctors to help them get safer and managing the virus. How far is this gone, and what are you doing to ensure this is done quickly?
Well, thank you very much. It is sad that the second wave has come. It's also sad that even at the beginning, and perhaps still now, not many Nigerians believe that there is COVID. And therefore, they are not complying with the NCDC protocol of hand washing and use of sanitizers, use of face masks, and social distancing. And now we've come to this stage, and this stage appears to be deadly. Many more people are dying, including some of our colleagues who are paying supreme price for giving service to the nation. As to training, of course, training and retraining is a part and parcel of the calling of the doctor. And we train regularly, we retrain regularly, build our capacity, particularly to the emerging and re-emerging diseases, now COVID-19 pandemic that has come. We find that we need to do a lot of training for health workers, not just for doctors, in areas of infection prevention and control. That we have the commitment. However, we need support from government, in this case, Federal Ministry of Health and also the PTF. As you know, PTF is in charge of the containment of the national response of COVID-19. And we need to work with them, or they need to work with us, so that we can work together and contain, reduce the ravaging pandemic of COVID-19.
Okay.
In doing so, we need to continue to train, and we need financial support. We need to get people are ready for training. However, this can't be done now until after the holidays, and New Year is coming. As soon as the New Year is over, we will then meet with them and discuss with them.
All right, sir. I know that during the first phase of the COVID-19, we had issues of inadequate PPEs being distributed to the hospitals. How equipped are we now? Is there progress in that regard? Do we have enough?
Well, how far have we gone? Do we have enough? The issue is that we will never have enough. But what we are saying is that we should regularly have the infection prevention materials, i.e. the PPEs. And the government has improved on what they were doing, and we expect that they sustain it. We still need more of the PPEs as long as we are battling with the COVID-19. Because we don't know how far we can go. We don't know what else will come. And the most important component of this response is the preparedness. We have to plan, we have to prepare, and then we respond. And we believe that working with government and other stakeholders, we should be able to contain the disease, but we do not know the extent. To say that we have enough, we can never have enough. As you know, there was one time when there was an error of statement or maybe misrepresentation that Nigeria has enough doctors. There is nowhere in the world that a country has enough doctors. So we do not have enough doctors.
Okay.
We do not have enough PPEs. But we expect that the government will continually supply these PPEs so that we reduce the risks and hazards of the health workers, the doctors, and the nurses.
Okay, let me get a few more questions.
Okay, sir. You said that the government, they've been doing a lot. And I wanted to know if it included, because even if we can't provide enough PPEs, we should be able to provide enough insurance, health insurance or life insurance for the doctors on the front lines. Do they have health life insurance or, work as something like that for the doctors, so that we can be sure that those that have died, their families are well cared for, or, those that are working will be motivated to keep fighting?
Well, you are right. It's not the issue of life insurance has been on for some time. We are told that the process is on, but we, at the moment, doctors and other health workers who should have life insurance do not have the life insurance cover, and that is something that we will have to continue to pursue. We started it at the beginning of the pandemic. We were sure that we would get the insurance, the life insurance, but that is far from coming. The second is the issue of the hazard allowance. The government paid hazard allowance for 3 months and stopped and said we will evaluate it in the hope that they thought that pandemic will go within 3 months. You and I have seen that pandemic is not only going, but it's getting worse with the new strain and then the new pathologies, the fatalities that we are recording. So obviously we need to review with government this, because the hazards, the risks of facing this pandemic is so much, and it's only good and well if the government will respond appropriately by interfacing with the doctors and the nurses who are at the front line to ensure that they are motivated. This is a time for motivation. We do not want this incentive. We don't want our doctors to be demotivated. And one way of motivating them is to ensure that life insurance cover is provided, and hazard allowance that is paltry at the moment, 5,000 naira per month, should be improved upon. And we have to negotiate this so that there is no allowance that can buy a human being. Once you die, you die. But you see, when you are working, you should be motivated, and that is part of motivational strategy for people to know that, well, they are being supported, their services are being valued, and therefore they show more commitment and dedication to their duty.
Let me go on a quick break. When we come back, we'll continue this conversation with Professor Ujah. Stay with us, we'll be right back. Thanks for staying with us. We have with us Professor Innocent Ujah, who's the president of the Nigerian Medical Association. Sir, are you still there?
Yes, I am.
Okay.
Thank you.
Okay, go ahead.
Yeah, I was going to ask, you said you're going to check, see about it after the holidays. And I'm wondering, isn't that too much time passed? Because the holidays are like 2 weeks. And every day, more doctors are getting infected. Every day, their hazard allowance is not being attended to. I'm wondering, isn't it something you should do now? And then another thing is, you said the government is...
You know, it's very easy to say we should do now. If you go to the office, who will you see? Yesterday was public holiday. People are just coming in today. Today is Tuesday. We will be discussing with them. I don't want to be moving moving from office to office. I want to move to office where I can see people to discuss with. And it is not 2 weeks. When I say holidays, I said New Year. And New Year is when? It is on Friday. By Monday, it is possible that we can interface with them. However, you also know that whatever we are discussing, they are aware. I mean, I've had some private discussions with some of the ministers, and all we need to do is to have people with whom we discuss. And it's not just the minister, you know, they have directors and the officers in charge. So we will do the best we can. Meanwhile, we urge our colleagues, doctors, to ensure that they treat every case they see in the hospital or anywhere as a case of COVID-19. In that case, they must necessarily protect themselves using the infection prevention protocol. And in that case, minimal number of our colleagues would be infected, and minimal. We don't even want any one of them to die at all in providing service. Yeah.
Okay.
Yeah, please, that brings me to my next question, which is, you said the government was doing a lot, but my own personal opinion is the people are not being sensitized.
I didn't say the government was doing a lot. I said the government was responding to our request. I didn't say the government was doing a lot. In any case, whatever the circumstance, you know that this is some prepare.
I was actually asking about sensitization.
Said what?
I was asking about sensitization because right now you are talking to the doctors to treat every case they see as COVID. I'm actually talking about sensitization because I feel that if government sensitizes people more, people will take the disease more seriously. And that's what has been happening on from day one. Like, I think every single corner you go to, there should be information, there should be advertisement, because information is key.
Okay.
Yes, I agree with you completely. And that's what the media is doing as part of their own contribution to the national response. Secondly, I've also said that the National Medical Agency should up its game to continue to inform and educate people, and also to sensitize people, create awareness. And this can be done in several ways, through a traditional form of communication, i.e. using town criers, using the traditional rulers, or town hall meetings, and all forms of strategy they can use to pass information, educate people, and answer questions on those who probably do not even believe that COVID-19 is real. So what I'm saying in effect is that the National Orientation Agency should improve their information and communication system so that they can continue to educate Nigerians. That is the doctors' information process is very limited. It's limited to the patients. And we have an organ in Nigeria, that is the National Orientation Agency, that would sensitize, educate, and inform the public, while the media is doing its own. The radio, the TVs, and the rest should continue to give information in various languages to the people.
Professor Ujah, one of my greatest concerns is the seemingly, I'm trying to use the right word here, kids' gloves approach to this issue of COVID-19 in some ways. Because as the president of the Nigerian Medical Association, is there some kind of data that you and the doctors are gathering concerning what is happening right now, the trend we're seeing, what the patients are going through, what the doctors are going through? Do we have, are all hands on deck to support the federal government with data? Because your doctors, your organization, your association, they have the direct link with the patients. So what information are you sharing with the federal government? What information are you sharing with other doctors? Is there, what new trends are you seeing that can help us understand how to combat this better? Because many around the world, we've seen how all hands are on deck to see how much information they can get from the universities, from the government, from the scientists. What's happening in Nigeria? It's almost as though all we're waiting for is just for the PTF to give a press briefing. We don't have any other source for information. So what data are you gathering as an association to support?
let me tell you that if you do not know, part of the functions of PTF is to gather information through research. It should have a research component. The data collected by individual doctors are the properties of the hospital, and they are used in their hospitals. But the public health information using the public health data should come from the section of PTF, which is a research section. And by now, we would have gathered a lot of information from the field, and that is the responsibility of PTF and the Federal Ministry of Health. The Nigerian Medical Association has manpower to do that, but they don't have funds. So once they contact the NMA and say, look, we need this number of people to support us to carry out this research, we will willingly oblige, because we are committed to the national response. We are committed to the eradication or to the containment of COVID. But the
Okay, we're having some technical issues. Just going to quickly, when we come back, we'll continue with the conversation. Stay with us, we'll be right back. Thanks for staying with us. We still have our guest with us. Sir, Nima had a question for the break.
So before Corona, sir, are you there? Before Corona, we had other things killing Nigerians. We had Lassa fever, we have every other thing killing Nigerians. But we had our doctors, when they were trained on protection of infectious diseases, to protect themselves and, leave patients to themselves as well. So people started falling down, dying, not necessarily Corona, but because they couldn't see their doctors continue their treatments in the hospitals. And now the enemy is proposing training doctors on how to prevent infections while at work. Does it include, how to diagnose other illnesses so that people can also seek treatment for those illnesses, or totally just protect yourself and tell the person, be asking questions while they stay from a distance? What exactly does the protection against infectious disease training for doctors include?
Well, unfortunately, you will not understand when we put this thing that looks very simplistic. Infection prevention and control is a whole discipline of itself. It's not about diagnosing. It is about ensuring that you protect yourself and protect your patient. When you are seeing your patient, there are modalities of doing that, what you should do, what you should not do, to ensure that the patient is protected from infection. You hear, we will say infection prevention and control. It's not about
Okay, we're still waiting for the connection. I think he's going to be with us in a shortly. Okay, it's frozen right now, but we'll still try to get him reconnected.
And we can discuss amongst ourselves now. Yeah. Because from the way I see it, I don't think that Nigerians really believe in this disease.
And I think that is what it means. It's not about making a new diagnosis for a new disease. No, this is purely a discipline for which we have to protect ourselves and protect our patients too, because you'll be surprised that the doctor may have catarrh, and if he does not protect himself or herself, the patient who is before him or her will contract the disease. So in doing so, and in a circumstance of Ebola, COVID, we do not want doctors to contract the disease. And because we don't want them to contract the disease, they need to be trained how to handle a patient when the patient comes to see him or her. And that is what we talk about when we talk about infection prevention and control.
All right, Professor, I know that one of the responsibilities of the Nigerian Medical Association is giving unsolicited recommendations to the government so that we can all improve the health sector. Now, I would like to ask you, what are some of the recommendations that you have given in the past year, looking at how our health sector over the years have deteriorated?
Well, let me just say on this, the enemy has done very well. You recall that we have said several times that the health system in Nigeria has collapsed, and we need to resuscitate it. We have said that doctors are leaving this country in large numbers because of very unfavorable operating environment. We have also said during the during the
COVID.
When the first case of COVID-19 was discovered, we say we should close our borders. We said so. We have said everything that we needed to do. We said they should provide personal protection equipment, PPE. We said that people should be trained and retrained. We said that information dissemination should be, at the highest. We have said everything that needed to be said at every time. We said they should provide life insurance to health workers, not just doctors. We have also said that the hazard allowance of 5,000 naira is not only shameful, but it should not be talked about at all, particularly at the time of COVID.
Yeah.
We are saying that the doctors and health workers should be motivated. Right? So how else can we do this? We say that if they need if the services are required in areas of research or anything apart from our regular containment, we have deployed people to the front line and to isolation centers. I don't think anybody can fault the doctors on this, because at every stage we have brought our knowledge, brought our experience, we have brought our expertise to bear on the health system of Nigeria. And all that needs to be done is that the powers that be, the policymakers must listen to the experts. They must listen to the doctors.
Okay.
They are trained in this. They have the knowledge. They have the competencies. They have the experience.
All right, go ahead.
So what was the stand of the NMA when the government across board, all state governments started closing isolation centers within their states? Was it not, lack of foresight when they did not prepare or when they closed these places, with the recent spike that we have?
Again, you know that the NMA can advise, NMA can caution, NMA has no power of enforcement.
That's the problem.
The NMA has no power of enforcement. All we can do is to give advice, is to caution. You recall that when students were asked to, the schools were asked to reopen, we said they can reopen, but provided they are prepared. And what is the preparedness? I.e., we must ensure that we obey and comply with the NCDC protocol. But you saw what happened at the NYC camp. You now have records of the number of people that have contracted the COVID because of the fact that probably they do not want to, or they are unwilling to listen to the experts. Doctors have predicted this. You see, there is epidemiological characterization of every disease, and we are trained in this. And we only say that the government and stakeholders should listen to us because we are trained. We don't go to the marketplaces to make noise. We are trained and we give our advice. In fact, unsolicited.
Professor.
These days, no advice should be given free of charge. But we give our own advice free of charge because of our calling.
Professor,
and we believe that
I understand
we should be listened to.
Professor, we understand that very clearly. Giving advice or showing, expressing your professional viewpoints in issues like this is important. However, we Nigerians are used to people giving advice, discussing, giving recommendations. Our issue is not about your advice. Our issue is the implementation. Who do we hold responsible for not implementing? Who is the government? Who is the person in charge? Because the truth is that we know the right things. We have the laws, but nobody's implementing.
Yes, I'm sure you know the answer. That's why I say that the doctors have no power of enforcement. We don't have power of enforcement. All we can do is to give the advice, to caution, is to give our services when our services are needed. There is a government in place that is, we have Federal Ministry of Health, and for this particular condition, pandemic, we have presidential task
Okay,
force.
let me ask you a recommendation.
And that's the highest level of the response.
Let me seek your professional counsel in this regard. So we've had a whole year of the pandemic, and obviously it has brought to bear the fact that our health system is in serious state of decadence and we need a revival. What are your recommendations to the government at this point going forward? Because we've learned quite a bit about how much work and investment we need in the health sector. What are the notable things you think you have recommended so far to the government to improve this sector, to avoid brain drain, to increase research for our universities in the medical sector, and other things that's required in this. What have you done so far, sir?
Well, that we have done, we have documented. The truth of the matter is that, like you said, sorry. Hello, are you hearing me?
Yes, very clearly, sir.
Are you?
Yes.
Okay, fine. Now, what we have done is to give our advice in a memo form. But the truth of the matter is that for the public, we have done all that we needed to do. For one, we have now seen that COVID has exposed our nakedness to the weakness of the health system of this country. And we are very lucky, in fact, that what is happening in Europe and America has not come to Nigeria. If it had come to Nigeria, probably all of us would have gone. Because the number of deaths, is not as severe as that of Europe and America. But we don't want anybody to die as a result of this disease. So we've done the bit we can do. We have said, we see the truth of the matter is that when we say close our borders, nobody listens to us. So the reality is that if we must be documenting and learn and use the experience for the future, because the truth of the matter is that if we don't plan, we are not likely to succeed. Yes. We have learned some experience from, and I'm happy that the Secretary to the Government of the Federation had said that they didn't know that this is how bad the health system had been in Nigeria. So obviously, an officer of government, very senior officer of government, making that statement in terms of advocacy, I believe that that is something that is positive for the health system. All we need to do is to sit down, get people of credible knowledge and experience, not anybody, anyhow, or family and friends, to come and look at this health system. You need to put the government will need to put a crack team that will honestly work out what we should be doing from now. Because the way it is that if we continue this way, it will not be good for Nigeria.
All right.
So many of the recommendations that we have to make, we continue to make, because it's our country and we have to have commitment to the prevention, promotion of health in Nigeria.
All right, thank you very much, sir. It's been a great pleasure having you on the show. Sir. Thank you for shedding light on this. We'll be speaking with the President, Nigerian Medical Association.
Thank you very much, and
Professor Innocent Ujah.
Thank you very much for the good work you are doing. You need to propagate the information and disseminate the findings to the public so that they can comply.
All right, sir. Thank you, sir. Let's take a few tweets, guys.
So Mr. Adebayo is blowing hot here. He says infection control is a big thing in the UK healthcare system. We lack the structure in Nigeria. We lack the investment and the will to establish such to reduce the infection rates in Nigeria hospitals. I'm surely writing my project on it. He also says providing healthcare should never be a source for negotiations. Subsequent governments have neglected this sector, and the present are not helping the situation. Health is wealth. Until we know that, we will always revolve in a cycle.
Gabriel says, okay, where can you go?
Festus Akimbo Yewa says, majority of Nigerians and some governors are not taking COVID-19 seriously. Our journalists should please go to the hospitals and report what is happening there. It will wake up the state governors and Nigerians. Gabriel, it is quite disheartening that up till now nothing has been done for the families of those doctors who lost their lives, not to talk of making adequate provisions for the doctors and nurses who are on the front line.
Mr. Adebayo again says they are building railways and leaving out the health sector. Who will drive those trains when every staff is sick and have the potential to spread the disease? My country have so many clueless people in decision-making realm. Wrong priority.
Mutaza Miki Yusuf says, news of the death of 20 doctors in our battle against COVID-19 is unacceptable. Lack of personal protective equipment was a major factor that could have led to the death of our precious frontliners. NCDC must take the government to task on doctors' welfare. And Moses says, sincerity from the government and Nigerian doctors, including the entire citizens, both at home and abroad, is the only way COVID-19 will be defeated. Take responsibility.
See, I don't know.
I did a little research this morning, just before the show, because I wanted to really find out the functions of the enemy.
because I know that they have been making noise. Now it's been brought to the fore that they do not have powers beyond recommendations. So the job now is for those people who receive the recommendations to go ahead and implement. And it's obvious that we do not have the willpower from them to implement, because they don't feel the pains of Nigerians. They don't use the same hospitals that we use.
You need to understand what when you are in government. You see all the health commissioners that are in government now, they were probably in NMU. Making the same noise this man is making.
Yes.
Okay.
When you get there, it's a different ball game.
And the different ball game, YK, I think, is also other economic factors. So, if you're an enemy by yourself, your mind is shut the borders. But if you are in government, you understand that shutting the borders is not just a decision as a doctor. You now have to consider the economic factors. You have to consider other trade factors. There are many things to be considered. So maybe that's why if they're not implemented. But my own worry is, I think we are missing data. We need information. You know, when you speak to experts or presidents of organizations like this around the world, they're telling you X percentage of people have died, X percentage of PPP we have, this amount of young people, this amount of information is how much they need. You know, there's something, you feel that they have the information at their fingertips. Here, we are just going around. It's almost like we don't have enough data to know exactly what are the real next steps.
That was the question I wanted to ask him. I wanted to ask him. And that was, do you think, because what I suspect is a lot of people have got it, have gotten it, have recovered without even doing tests.
Nobody knows.
Nobody knows. If you tell me that I should go and do a test for 50,000, I realize the money
beyond your minimum wage,
and drink and go and get better or die off. Than go and use 50,000. That's not treatment to just tests. Yes. Now, I know of Nima's experience at the testing center. If I hear of that, am I going to want to go and subject myself to that kind of... So there are so many factors. That's why there's a school of thought that believes that, come, tell people what to do. So that if we fall in, we know what to do.
Give us the
treatment. Give us, you know...
How to treat ourselves at home.
So that we don't start dropping dead on the road. I know we have to run.
The state commissioner
we have to run.
There's somebody who has been abusing us here. Like we did not say happy birthday to his wife. His wife was yesterday to London people. So his name is Obon Lawrence Osezua. Osezua. And his wife is Helen Obo. Please, happy birthday, Helen.
Happy birthday,
Helen. Beautiful.
Very beautiful.
All right,
but the state commissioner, the state commissioner we're talking about during the first topic was the commissioner for education in Akwa Ibom, not Cross River State.
Oh, yes, you wanted to
so we cannot close without correcting.
Okay, fantastic. All right, that's all we can take. Have a fabulous day. We'll see you tomorrow. Bye for now.